Thank you for joining TennCare's Non-Emergency Medical Transportation Overview, brought to you by the Office of Compliance Management. Under the Non-Emergency Medical Transportation Program, all TennCare members have access to free transportation to their appointments for covered TennCare services. Upon completion of this video, you will understand what is non-emergency medical transportation, also known as NEMT, how transportation is scheduled, what information a member needs to schedule a ride, and what determines the type of transportation needed for each trip. We will also discuss types of transportation, getting a ride home, the NEMT Mileage Reimbursement Program, hospital and facility discharge process, the 72-hour advance notice, and common scheduling challenges. First, let's discuss what is non-emergency medical transportation, also known as NEMT. NEMT is a TennCare covered benefit which provides non-emergency medical transportation to all members who do not have a ride to a TennCare covered service. NEMT services are not intended to be used for 911 situations. The TennCare member will not experience any out-of-pocket expenses during their NEMT services, and NEMT services are available 24 hours per day, 7 days per week. Now that we know what NEMT is, let's discuss how a member can schedule an NEMT trip. To book a trip, the member or their representative should call the NEMT call center for their assigned MCO. The member should plan to schedule their ride at least 72 hours in advance of their appointment. There is no limit to how far in advance a ride can be scheduled. If the appointment is considered urgent and it is not possible to give the 72-hour advance notice, the trip will be escalated for verification of urgency with the medical provider and handled accordingly. To ensure the member receives the appropriate level of service based on their individual needs, the NEMT call center uses a call script approved by TennCare, which includes a questionnaire. Now that we've covered the basics, let's talk about what specific information the member needs when scheduling their ride. To schedule a ride, the member must provide a Social Security number or a TennCare ID number, the member's name, date of birth, phone number, and the address where the member would like to be picked up, the date and time of the member's appointment, as well as the name, address, and phone number of the member's medical provider. The member should also disclose any mobility needs, such as the use of a cane, walker, wheelchair, or stretcher, and the required level of service needed for the member, such as door-to-door, hand-to-hand, or curb-to-curb. Finally, the member must disclose any extra riders to be included in the ride, such as the member's escort and any children that will accompany the member to their appointment. This ensures the appropriate seating for the reservation. A member must provide a car seat for children requiring a car seat based on the child's age and weight. Car seats must be transported to the member's appointment. As a provider, you may observe your patient waiting after the appointment is complete. This next section explains what you should expect as a provider. Sometimes, you may observe a member waiting for up to 1 hour for their ride. This is what the NEMT program calls a will call trip. If a member did not pre-schedule a specific time for pickup, the member must contact the NEMT call center to request a will call trip. The NEMT driver is allowed up to 1 hour to pick up the member. For what is known as a pre-scheduled trip, if a member knows what time their appointment will be complete, the member has an opportunity to call the NEMT call center to schedule ahead for a ride following their appointment. In these situations, the NEMT driver must arrive within 10 minutes of the appointment end time for the trip to be considered timely. If the driver is late for pickup, the member is able to call the NEMT call center using the toll-free number for Where's My Ride to receive an update on the driver's status, or the NEMT call center will assign an alternate driver if the driver is unable to present for pickup. As a provider, please be mindful of the timeliness of the member's appointment if the member makes the provider's office aware of their participation in the NEMT benefit. If the member is late for pickup, then the NEMT driver will contact the NEMT call center to notify them that the member is not present. The NEMT call center will contact the member and/or the provider to obtain the member's status. The NEMT driver is not allowed to leave without approval from the NEMT call center. Often, members will be prescribed medication for pickup at a local pharmacy by providers. Pharmacy stops are strongly encouraged to be pre-scheduled because they cannot be guaranteed. Members are allowed to schedule NEMT trips solely for a pharmacy visit. Members are also allowed to pre-schedule a pharmacy trip following their appointment. It is likely that for a new patient visit, that the member will not know what prescriptions will be ordered by the provider. Members are aware that if they suspect that they will need to stop at a pharmacy following their appointment, they should schedule the pharmacy trip during the initial scheduling of their appointment. As a provider, you may receive contact from the NEMT call center requesting you to confirm the urgency of a member's same-day appointment. The call center representative will identify themselves, the name of the member, and the date and time of the appointment. You'll be asked to confirm the urgency of the same-day appointment so that the NEMT call center can dispatch the NEMT driver for the member. Please accept this call and provide the requested information. Once the information is gathered, the NEMT broker will determine the type of transport required for the trip. The type of transport is primarily determined based on the member's specific needs. Considerations are given to the member's mobility requirements and any additional riders accompanying the member. Once specific needs are established, the NEMT call center will take into account provider availability and then determine the most cost-effective method of transportation. Transportation network companies, such as Lyft and Uber, are used as a last resort after all other transportation options are exhausted. The method of transportation selected by the NEMT broker is based on accommodating the member's need, such as mobility needs, and not the member's preferred method of transportation. Once the NEMT broker weighs in all the factors, a transportation provider type is selected. Types of transportation providers include ambulatory vehicles, which describes any vehicle that accommodates any member who does not have mobility restrictions. Wheelchair vans, which include a lift to allow members to stay in their wheelchair during transport. Shared rides in a multi-passenger vehicle, which allow transport of each member to their appointment while accommodating multiple requests simultaneously. Stretcher vans, which provide transport for a member who is not mobile and cannot transfer themselves from location to location. Bus passes, which are available to members who live in close proximity to a bus route. And transportation network companies, which can be used to transport members that do not have mobility restrictions. This option is used when the NEMT broker has determined this method as the most cost-effective transport. This service is primarily used when no other options are available. Examples of this type of transport are Lyft, Uber, and taxis. Finally, a member mileage reimbursement allows reimbursement to members based on the mileage of the trip when they have a family member or friend who is available to take them to their appointment. Let's discuss TennCare's Member Mileage Reimbursement Program in greater detail. The Mileage Reimbursement Program, MRP, is available to members who may have a neighbor, friend, or family member willing to drive them to their appointment. This program allows the member to be reimbursed based on mileage to and from their appointment. The reimbursement will always be made to the member. The member can then make the decision whether or not to pay their driver. Methods of reimbursement may differ based on the member's MCO. Options include check, direct deposit, and a reloadable card option. Each MRP trip must be scheduled through the normal NEMT process in order to receive payment. The call center will guide the member on how to assure payment. Transportation is intended for TennCare members who do not have access to transportation. Exceptions are made individually for members who do have a vehicle but have financial restrictions that do not allow them to use their vehicle. Another NEMT benefit is hospital and facility discharge pickups, which we will discuss here. The time begins once the pickup is called in by the discharging facility. The discharge team can expedite the pickup by scheduling as soon as they become aware of the need. To start, a discharge from a hospital or a facility is considered an urgent trip. TennCare allows the NEMT providers 3 hours in a non-rural area and 4 hours in a rural area to arrive for a discharge pickup. The discharge team cannot contact a transportation provider directly. The pickup must be scheduled through the NEMT call center of the member's MCO. If the member has a family member or friend to pick them up, the member or discharge team can request to utilize the mileage reimbursement program to avoid any wait. Now, let's discuss the 72-hour advance notice requirement. When the request for transportation is made without the required 72-hour advance notice, the NEMT call center will ask clarifying questions to determine if the call should be passed on to their escalation team. The escalation team will contact the medical provider to verify if the member should be seen right away, or if the ride can be rescheduled to allow for the standard 72-hour notice. If the medical provider confirms the urgent need, the call center will work to schedule the ride. Same-day requests that have been confirmed will be handled as an urgent request. While non-emergency transportation requests generally go smoothly, there are some common challenges which can make scheduling difficult. The pickup location sometimes presents a challenge. Specifically, rural areas of the state do not have as many options as non-rural areas. In some areas, EMS is the only option for NEMT. The EMS providers also provide 911 services which take priority. Another challenge is methods normally used as last resort options are not available in rural areas. These can include Lyft, Uber, and taxis. Another challenge is member no-shows. When members do not cancel their scheduled trip in advance, cancel at the door, or do not come to the door, the provider is not available for other trips. The NEMT provider does not get paid for the trips if the transport does not occur. Long mileage trips that result in a member no-show strains the provider network and is financially draining to the providers. When a member is a repeat offender as a no-show, it can be difficult to find a transportation provider to accept their trip. Finally, when members are known to have disruptive behavior, it may be difficult to secure a driver. Now that we've gone over the major talking points of non-emergency medical transportation, let's review some frequently asked questions. Can the member call Lyft or Uber directly and get reimbursed? No, The member must call the MCO's NEMT call center to schedule each of their transports. The agent will determine the appropriate method of transport. How many children can a member take with them to their appointment if they do not have access to daycare? The member is not limited as long as they disclose the number of children during scheduling. This will assure the seat space is available. Can the member choose who they ride with? No. The decision of transportation provider is based on availability, the member's physical needs, and cost effectiveness. Member choice is not guaranteed. What if the member refuses to ride with a transportation provider based on previous experiences? The member should report any issues to the NEMT call center or MCO to assure issues are resolved. Provider choices are limited in rural areas of the state. If a member refuses to ride with the provider available, this limits the ability to provide their service. They will be offered to use the member mileage reimbursement or encouraged to utilize an available provider. If you need to schedule a trip, you may do so using the toll-free numbers. If your driver is running late or you have questions about a scheduled trip, please use the toll-free number and select "Where's my ride?" using the appropriate option. If the member has concerns or complaints about their NEMT service, please contact the NEMT Broker first. They will be able to provide a faster response. If you have contacted the NEMT Broker and your concern continues to occur, you should then reach out to the MCO and/or TennCare contacts. Please note and share any information that you have regarding your experiences with the NEMT Broker that attempted to assist you with your problem. Thank you for watching. We look forward to working together to provide non-emergency medical transportation to TennCare members.